much better now.
So, have we had the response from the blood work?
Yes, all the blood came back as normal, within normal limits, which is great for an 11 years old dog.
Excellent.
That allow us to use a standard procedure, which is less risky. Yeah, we are going with an approach of anesthetic for geriatric dogs. Now she has been pre-meded, and because she hasn't been settled to have the IV line done while she was awake, we've decided to administer the pre-medication first to let her chill down a bit and to
reduce the stress.
Absolutely.
For an OAP.
Yeah.
And what are you doing here, young lady?
So we've just placed an IV catheter, and we're now flushing just to check that it's potent for when we induce her for her anaesthetic.
And is that all good?
Yeah, and that's all flushing fine. It smells so bad.
Wow. Look at this ulcer.
On the lip.
So we're in the dental room, and this is the importance of doing dental. I mean, look at this.
On the hair.
I mean, this is incredibly painful. Wow.
This is
So
all hair
today,
build up here.
we will be improving the well-being of this dog massively. Wow. That's incredible. So this is the anesthetic, and this is the special formula for the geriatric dogs.
We're inducing the anesthetic now. She's getting asleep.
So I'm noticing you're using, okay. And that flush again is just to push it all the way into the system.
Yes.
So we have the maximum dose.
Basically to use all the dosage calculated for her. Okay. Lift her head, please. Very, very smelly breath.
Wow. That's quite an odor.
Okay. We'll need to secure the endotracheal tube. Not sleep too deep. Injury the lungs. Okay, ciphers.
Nurse, what are you doing right now?
So we're just giving her non-steroidal pain relief, Metacam, just an injection that will last her 24 hours, and should she need it, she can go home on the oral suspension starting from tomorrow.
And that's a particular anti-inflammatory or painkiller?
Both anti-inflammatory and pain. It's effectively
and pain relief.
And pain relief.
animal ibuprofen.
Okay. Check up. Let's take a look.
And these are all sterile kits.
Always, even if dentals are considered dirty procedures, we are following protocols like into a normal surgical procedure.
And I think one of the things that we want to be proud about at Noah's Ark is that we have a totally separate dental room.
102, 103, 104 all in place. 104 with gingival wrist. I will apply a stitch in here, just trying to save the tooth. Yeah.
Right.
105, 106, 107. 107 has to be removed. Furcation is exposed. As you can see, I can go with the probe in between the tooth.
Wow.
Roots. Yeah. This is not allowed.
Wow.
Okay. One oh eight, it's okay. 109. okay, 110, okay, just, oh no, another issue. 109, it's wobbly. Look.
Wow. The importance of dental.
It's wobbly.
This must be so painful.
And yes, it is painful. Alright, lower, which is 400, 401, 02, 03, 04, 05, 06, 07, 9, 11, 10. All good. Those needs just scale and polishing.
It seems the top jaw is the one that...
Most of the times is the most effective one. Let's turn her, yeah, for all in place. Same gingival recession on 204 like on the other side. 5, 6, 7, 8, 9, okay. 10, okay. Just scaling and polishing. 301, 02, 03, 04, 05, 06, 07, 08, 09. All good. So full mouth, no teeth missing, yeah?
Cool.
And she needs 2 extractions.
Yep.
And also a very nice
Bit of,
scale and polish.
bit of doctoring around.
We are starting.
So we promised the client that even during the dental procedure, we will stop and make a phone call.
We've got, hello, Lottie's having her dental as we speak at the moment. I'm going to pop you on loudspeaker so that you can talk to the vet. One moment. It's on loud. It's on loud.
Hello. Hello, Vlad speaking. So I did the assessment of her mouth, and we'll need to extract 2 teeth. One of the teeth got an furcation exposure. That means the root is exposed, and in time she will develop an abscess there. And the other one is one of the back molars. In that area where she didn't allow us to touch her and to take a proper look into the physical exam. And this one is very, very wobbly. So that means all the ligaments of the tooth and the root are compromised, so has to be removed. So it will be just 2 extractions.
So we have a surprise tooth that's come out.
Yeah.
And already
Basically fell off. So
wow.
I didn't have to extract the tooth, just fell off.
It's amazing how nice and clean this is becoming.
Yep.
We have a control to this, yeah?
All right.
Oh, the hygiene is so important. Look
Absolutely.
at this. Wow. This canine is going to be so relieved when it wakes up.
Yes. Can you open me the suture material, please?
Happy with this?
Yep.
So, doctor, what are you doing here?
I'm recovering the tooth with hope that will save the tooth. Otherwise, if the gum recession will be still in place, some point this canine will be required to be extracted. But that's only because of the gum recession.
Sure.
Pulling down the soft tissues covering the tooth, it's possible to save the tooth. But there's no guarantee.
But at least we are trying.
Absolutely. First of all, we are trying to save, and afterwards, because the extractions are so simple but irreversible, there's no way back. We are trying to save the tooth first. Looking now,
Wow.
the gum is covering the tooth base, and we'll see. Okay,
Fantastic.
the rest of the teeth has been cleaned. We will do the polishing at the end. Let's turn the patient now.
So doctor, you know you have to do the extractions, but what you've decided to do is clean first.
We are descaling first of all to reveal all the issues, and afterwards to remove all the dirt from the mouth, because if we are doing the extractions first, basically we are leaving an open space which can be filled with all that dirt removed from the other teeth. So
Sure.
it's a normal order, and yeah. This one is a bit more affected than the other canine. Hard to say if we can save this one, but
We will try.
we will try first. But my feeling is that this one shall go some point very soon.
Sure.
But as I told you, we are trying to save first and remove in second instance. One is dead.
Hole in there as well. That must be so painful.
Yes, it is. And we knew it. It's
Wow.
exactly the same like in humans, but they can't tell us
And you know, as a behaviorist with dogs,
what's coming from underneath.
wow, wow, wow. What is that?
It's hard to say. It's a very hard consistency
It's
thing.
almost like a stone, isn't
Maybe
it?
like a tiny stone or
And that's been lodged in that tooth.
part of the tooth.
Wow.
Okay.
Wow.
I'm cutting the tooth in two.
And that will give you the opportunity just to pull it out a lot easier. Wow.
See?
Very
Half of the
clever.
root was compromised. Half of the root was already compromised. Now we are releasing, cutting the the other ligament from the other half of the root, and you'll see how easy it will come out. Done.
Wow. As we start to train more dogs and revert them here for health and dental health analysis, it's going to be interesting what percentage of dogs have come in for behavioral issues, randomized, to see if they have any ancillary health issues.
Yeah.
And then when we repair or improve those health issues, before behavior modification, we'll see how the control is. Do they just, standardly start behaving in a more conducive way? What's your comment on this as a hypothesis?
So
Pain and behavior.
pain
Bad behavior.
and behavior are very close related. All the times when a pet is in pain, he's changing the behavior. Are so many ways to change the behavior, but when we are speaking about dogs, the most behavioral change is in terms of an increased reactivity and aggression.
100%.
And
Intolerance to young children.
intolerance to any kind of environmental stimuli.
Yeah.
And that probably is leading to some wrong decisions
100%.
regarding to euthanize the...
But is it also fair, Doctor, to say the autonomous reactivity based on chronic pain is, in some instances, out of the animal's control? We've
Absolutely.
seen it. Yeah.
It's an instinctive, not controlled reaction.
Yeah. It's not planned, and
no.
this is why it's so
Not
important.
with any kind of intention,
100%.
but it's their mechanism of defense,
100%.
which is...
I mean, we have human studies that shown that humans that are exposed to chronic illness suffer from depression, suffer from anger issues, become exclude themselves from society. There's many aspects of unfortunate concerns for dogs because they don't know how to express and tell you. You must be autonomous in your healthcare plan, and we will help guide you.
Yeah.
Remarkable.
Use cup, single-use toothpaste.
Toothpaste.
Yes.
Okay.
It's it's like polish solution for the teeth.
Wow.
It's, to make a parallel, is similar when you are detailing your car paint.
I see. Wow. What a treatment.
Let me change the...
So when people book in just for the dental clean and scaling, their teeth will be polished like this as well, sir?
Yeah.
Okay.
Will be cleaned with the ultrasound machine. That's the reason why we can't do a professional scale and polishing without full general anesthetic, just because dogs and cats can't cope with the frequency of the machine.
Sure.
They can hear it and it's very
Or
annoying.
even the trust of a stranger.
Yeah.
In many of the working dogs.
So, how have you found the service for today for Lottie?
Well, firstly, I found this place because I rung my vet and it was a ridiculous amount to have her teeth taken out. I'm really sorry, but she's out of it a little bit.
She's very tired.
But I find the vet was very informative, rung us all day long to let us know how she was getting on. They took blood tests before she went in. I think it's amazing so far.
So you feel like you've had good value for money, and that
Yes.
she's been.
Well,
you've
I'm
been.
doing my other jobs now.
Yeah, brilliant.
So she can get her teeth because it's an expense that people don't really pay out on.
No, and it's important that we make it affordable enough
Yes.
so that we can treat these poor
Yeah.
animals, because at the end of the day, their health will always come first.
Exactly.
Ah,
Exactly.
thank you.
Please feel free to call the Noah's Ark team for any type of support that you might need. We have a state-of-the-art facility set in 55 acres. We also have paddocks that clients can use for running their dogs. And due to our sort of historic ability to handle the more powerful working dogs, we specialize in that aspect.